Good evening. Today is March the 19th, 2020, and I'm presenting the next segment of the Hamlin County Coronavirus Task Force. The following is a list of questions that people have had about the hospital. The medical staff and administration have provided the following responses. It should be noted that all data was dated March the 18th, and things may have changed since that time. Number one, what do we know about confirmed cases in our areas? What we know so far are there are no confirmed cases of COVID-19 in Hamlin County. There is one case confirmed in Jefferson County, one in Sevier County, and two in Knox County. The information we have indicates all of these individuals have traveled outside the country. There are a total of 73 cases in Tennessee at this time, and a majority of them have been clustered around Davidson and Williamson counties. Who is at the highest risk? The highest risk populations are the elderly already with health issues, such as respiratory or immune compromising conditions. Currently, only 6 of the cases confirmed in Tennessee are individuals over the age of 65. Number 3, what are the best things I can do to prevent getting this virus? The best preventative measures are to stay away from crowds, keep 3 feet between yourself and others if at all possible, cough into your sleeve or use a tissue and discard it immediately, and wash your hands and clean surfaces frequently. Number 4, what are the symptoms of coronavirus and what should someone do if they have these symptoms? The most common symptoms are a dry cough, a fever, shortness of breath. The best thing these individuals can do is self-quarantine unless you need to seek medical treatment. This is a virus, so antibiotics are not beneficial in treating this condition. To be tested, call your primary care provider and review your symptoms. They will direct you to the next step. If hospital care is needed, please call the emergency department first and they will direct you as to where you should present for evaluation and treatment. A majority of these cases are going to present similar to the flu. Inpatient treatment is usually only needed for fluids and respiratory issues. Number 5, with schools closings, is there an option for childcare? In our community, Hamlin County schools are closed through the end of March 31st. However, the Board of Education realizes the impact this has on working parents. Therefore, they have set up a daycare at Hillcrest Elementary School, and they're making this service available to Morristown Hamlin employees, regardless if you live in Hamlin County or not. The daycare is available from 6 o'clock in the morning to 6 o'clock in the evening. For more information, please call Kelly Smith at 423-586-1668 or Smith K at hcboe.net. As a side note, the Hamlin County School System also has a plan to provide food to students during this time that students are out of school. Our school system has done an excellent job of stepping up to help and support our community during this time of need. Number 6, do we plan to restrict hospital visitation? At Morristown Hamlin, we are receiving directions from Dr. Mark Brown, Covenant Chief Medical Officer. At this time, we are restricting visitation to 1 person with a patient in all areas. We will be locking the doors at the hospital and having all patients and guests enter through the old admissions entrance. We will have a station set up at the entry point to question where people are going and to ask some screening questions. Everyone will be required to have their temperature taken and to use hand sanitizer. Different colored name tags will be issued depending on which area they hope to visit. Number 7, do we have enough supplies? We are evaluating our stock of essential items and trying to get as many supplies in as we can. Some supplies are being managed by the corporate to allocate supplies to those entities with the greatest need. However, all systems across the county are trying to get the same items, so we have to be diligent and use our resources sparingly so we have them at availability when patients need them the most. We want to make sure that they are available when patients need them. Number 8, are there any changes to our meals? You will also notice that we have made some changes to our meal services as we are suspending self-served food, including the salad bar. Number 10, will we continue to do elective surgery cases? At this time, elective surgeries will continue. All patients with scheduled procedures will be screened asking questions about travel within the last 14 days and be looking for symptoms of cough, respiratory issues, and fever. All patients will be limited to bringing only one additional person with them to the hospital. Number 11, what about students? There has been a great deal of discussion around students. At this point, the covenant decision is to allow nursing student rotations, but we will ask all other disciplines not to be in the hospital for the next 30 days. Several schools have already made the decision to remove students from clinical settings. We hope that this situation resolves itself quickly and we can have all students back in the hospital because students are valuable members of our team. Number 12, where can I get the latest information? The latest information is available on CovNet, which is updated every time we have new information. Hospital message on hold information is currently being updated around the latest coronavirus information for the general public. Number 13, what if I have travel planned? Look for return to work travel guidelines coming out this week. Also speak with your manager about your travel plans. Travel out of the United States, cruises, and travel to hotspots of the virus spread will require a period of quarantine before you're able to return to work. Make sure you understand the guidelines before leaving on any planned travel. Take care of yourself. If you feel sick, please stay at home. If you feel you have coronavirus symptoms, please call your primary care provider. Please distance yourself from others as much as possible and stay out of large groups. Practice diligent hand hygiene. You are our greatest and most valuable resource. We certainly do appreciate your attention to this broadcast and we wish you the best. It is our intent that these broadcasts will help keep you updated and current. Thank you.